NCLEX Study Guide. Questions and answers. 1. Fundamentals of nursing. Question: the nurse is reinforcing teaching with a client about using a cane. Which of the following instructions should the nurse provide? Correct answer: move the weaker leg first when walking. Explanation: the cane provides support to the weaker side, but when walking, the weaker leg moves first along with the cane. Then, the stronger leg moves forward. 2. Pharmacology. Question: a client with hypertension is prescribed furosemide, Lasix. Which electrolyte imbalance should the nurse monitor for? Correct answer: hypokalemia. Explanation: furosemide is a loop diuretic that can cause potassium loss, leading to hypokalemia. Monitoring potassium levels is essential. 3. Medical surgical nursing. Question: a nurse is caring for a client with chronic obstructive pulmonary disease, COPD. Which oxygen delivery system is most appropriate? Correct answer: Venturi mask. Explanation: a Venturi mask delivers a precise amount of oxygen, preventing excess oxygen administration, which could reduce the drive to breathe in COPD patients. 4. Infection control. Question: the nurse is caring for a client with Clostridium difficile, C. diff. What should the nurse do? Correct answer: wash hands with soap and water. Explanation: alcohol-based hand sanitizers do not kill C. diff spores. Hand washing with soap and water is required. 5. Pediatric nursing. Question: a 3-month-old infant arrives for a wellness checkup. Which findings should the nurse report? Correct answer: inability to hold head up while on stomach. Explanation: by 3 months, an infant should be able to hold their head up when placed on their stomach. Delays may indicate developmental concerns. 6. Maternity nursing. Question: a pregnant client at 36 weeks reports dizziness while lying on her back. What should the nurse suggest? Correct answer: lie on your left side instead. Explanation: lying on the back compresses the inferior vena cava, reducing blood flow. The left side position improves circulation. 7. Mental health nursing. Question: a client with schizophrenia hears voices. What is the best response? Correct answer: what are the voices saying to you? Explanation: this acknowledges the hallucinations while assessing for dangerous content. 8. Nutrition. Question: which food is best for a client with iron deficiency anemia? Correct answer: spinach and lean beef. Explanation: iron-rich foods like red meat and dark leafy greens help correct anemia. 9. Pharmacology. Question: a client prescribed warfarin states, "I will eat green leafy vegetables daily." What should the nurse do? Correct answer: I will eat green leafy vegetables daily to improve vitamin K intake. Explanation: vitamin K reverses warfarin's effects, so excessive intake could reduce its effectiveness. 10. Respiratory nursing. Question: the nurse is caring for a client having an acute asthma attack. What medication should be given? Correct answer: albuterol. Explanation: albuterol is a short-acting bronchodilator, used for immediate relief during an asthma attack. 11. Cardiac nursing. Question: a client with heart failure says, "I can drink as much water as I want." What should the nurse do? Correct answer: I can drink as much water as I want to stay hydrated. Explanation: fluid restriction is often necessary in heart failure to prevent fluid overload. 12. Medical surgical nursing. Question: a diabetic client has confusion, sweating, and tremors. What should the nurse do? Correct answer: give a glass of orange juice. Explanation: these are signs of hypoglycemia, and fast-acting carbs like juice can quickly raise blood sugar. 13. Postoperative nursing. Question: a client reports a popping sensation at the surgical site. What should the nurse do first? Correct answer: cover the wound with a sterile saline dressing. Explanation: this suggests wound dehiscence or evisceration. Keeping the wound moist and sterile prevents complications. 14. Neurological nursing. Question: a client with Parkinson's disease has difficulty swallowing. What should the nurse do? Correct answer: teach the client to tilt their head forward when swallowing. Explanation: the chin tuck method helps prevent aspiration in Parkinson's patients. 15. Maternity nursing. Question. The fetal heart rate drops suddenly. What is the priority action? Correct answer. Apply oxygen via face mask. Explanation. Oxygen administration improves fetal oxygenation and can help stabilize the heart rate. 16. Medication administration. Question. The nurse is about to give digoxin but sees a heart rate of 55 beats per minute. What should the nurse do? Correct answer. Heart rate of 55 beats per minute. Explanation. Digoxin slows the heart rate, so hold the medication if the heart rate is below 60 beats per minute. 17. Safety and infection control. Question. A fall risk client says, I will wear socks on wood floors. What should the nurse do? Correct answer. I will wear socks when walking on wood floors. Explanation. Socks increase fall risk on slippery floors. Non-slip shoes are safer. 18. Pediatric nursing. Question. A toddler with dehydration has a heart rate of 180 beats per minute. What should the nurse do? Correct answer. Heart rate of 180 beats per minute. Explanation. Severe tachycardia suggests worsening dehydration and possible shock. 19. Mental health nursing. Question. A client is experiencing alcohol withdrawal. What should the nurse monitor for? Correct answer. Monitor for seizures. Explanation. Seizures are a serious withdrawal symptom that requires immediate intervention. 20. Endocrine nursing. Question. A client with hypothyroidism might experience which symptom? Correct answer. Bradycardia. Explanation. Hypothyroidism slows metabolism, leading to bradycardia, fatigue, and cold intolerance.